back at ACMID in 2018 here from Madrid, and my next interview guest is Dr. Amanda Paschke. You are Director of Clinical Research in the field of infectious diseases, and you have just been presenting exciting new data on the phase 3 trial on the treatment of carbapenem-resistant bacteria. Tell me a little more about it.
That's right. So this morning we presented results from our phase 3 pivotal trial evaluating the efficacy of imipenem-relebactam compared with colistin plus imipenem for the treatment of imipenem non-susceptible gram-negative bacterial infections. Patients in this trial had one of 3 infection types: hospital-acquired or ventilator-associated bacterial pneumonia, complicated urinary tract infections, or complicated intra-abdominal infections. And we evaluated primarily the favorable overall response to therapy in these patients, and that was determined by the most relevant endpoint for each of those infection types.
And what were the results, of course?
So compared with colistin plus imipenem, imipenem-relebactam had a similar efficacy outcome at that primary endpoint, which was expected. For the colistin arm, we did optimize the dosing of colistin so that the patients, who are quite medically fragile, in most cases critically ill, received appropriate therapy regardless of which arm they were randomized to in this double-blind study. So at the primary endpoint, the results were comparable. And then at a couple of key secondary endpoints, which included favorable clinical response at day 28 following randomization, as well as all-cause mortality at day 28. In both those situations, the outcomes favored imipenem-relebactam.
Now, always safety is an issue in those studies. What about safety?
So safety, the primary or most important safety outcome that we had in the trial was treatment-emergent nephrotoxicity. As people may be aware, colistin, the comparator, is often associated with nephrotoxicity. And so we wanted to make sure that we looked at emergent nephrotoxicity in that arm compared with what happened to patients who received imipenem-relebactam. And we found that there was a significantly lower incidence of treatment-emergent nephrotoxicity in patients who received imipenem-relebactam, and this was statistically significant.
And the number of patients you treated in this study, or you enrolled in this study?
So 50 patients were enrolled and treated. 47 of those were in the randomized arms of the study. And of those 47, 31 were in our primary analysis population.
Yeah. And this was obviously a multi-center study, wasn't it?
This was a multi-center global study. We had patients being enrolled in North America and Europe and Asia, so around the world, a variety of institutions.
So did you expect these quite positive results then?
We did, I think, with regards to the efficacy, that again, because we optimized the dosing of colistin, basing it on the current literature, state-of-the-art, as well as our own internal PK/PD modeling, we expected a similar outcome for those patients. And again, those patients are very sick, so we didn't feel it was appropriate to give them a treatment that wasn't going to be effective for these very serious and difficult to treat infections. So for the efficacy, we did expect comparable efficacy. For the safety, we did expect to see a difference in nephrotoxicity. I think, though, we were surprised by the magnitude that there was such a divergence there. And I think that shows that imipenem-relebactam has the potential to treat these infections and is possibly safer with regards to renal safety than a typical standard of care regimen that's used.
So this was a phase 3 trial now. What would be the next step for you?
Well, it's our pivotal trial. So the next step, typically after that, is regulatory submission and hopefully approval so this medicine can become available for patients. And then we have other ongoing research efforts in this population. In particular, right now we have an ongoing larger phase 3 trial in nosocomial pneumonia.
With a number of patients?
Number of patients, much larger, 536 patients.
Oh, that's much bigger
in that study.
Okay, then good luck for this new study and your research.
Thank you.
Great pleasure to have you here, and all the best for you.
Thank
and
you
enjoy
very much.
Madrid, of course.
Thank you.